we've got a unique kind of population here, plus how to deal with the federal health care law, Obamacare as it's called. What's happening as far as you know in terms of the federal exchange being set up, and what's going on with regard to where the state is on Medicaid expansion?
Well, I think the state of Florida is very similar to what other states are looking at. Is we keep seeing delays. The individual mandate continues, but the business mandate has been delayed. You know, what impact is that going to have? And I think you also have to really evaluate how many companies are going to drop below the 30-hour limit in order to not be required to provide the insurance. We as a state of Florida, I think, we need to be analyzing all that and working with our colleagues in the House and in the governor's office and talk about the Negron plan, which was not necessarily Medicaid expansion, but really looking at the private market to try to address some of these individuals that are not going to be covered under any other plan.
I know President Gates said in an interview that I had with him last year was, you don't want to necessarily be the first group into the line of fire. You still have some time before the federal law comes into effect to see what works and doesn't work. Are there some ideas beginning to be floated, perhaps in terms of Florida having an approach to participating in the Medicaid expansion, or is it too early to tell?
I think it's probably still a little too early to tell. You know, again, it's daily reports of what other states are trying to do. And again, it's difficult for a state to plan for the potential change when everything keeps getting delayed. And I think that's what we're kind of watching. But I think President Gates has done an incredible job empowering the senators to say everything's on the table. What do we need to be addressing? The reality is, even when the national plan takes effect, there's still going to be millions of people in the state of Florida with no health insurance at all, which ultimately you and I as taxpayers will be left with that bill, and we need to address that.